Welcome to Blue Briefing. Our video will examine a recent publication in the American Journal of Respiratory and Critical Care Medicine titled Assessment of Respiratory Mechanics and Inspiratory Effort During Spontaneous Breathing Trials to Predict Extubation Failure in High-Risk Patients. The process of extubation is a critical step in intensive care. Spontaneous breathing trials, or SBTs, are commonly used to determine whether extubation will be successful. These trials rely on conventional measures, such as respiratory rates and tidal volumes during the trials. However, these tests are not sensitive for high-risk patients who develop respiratory distress after extubation, despite performing well on spontaneous breathing trials, thus requiring re-intubation. Studies suggest that our conventional parameters may overlook early signs of respiratory distress. To address this gap, researchers conducted a multi-center study in patients at high risk for extubation failure who completed a standard 30-minute SBT based on conventional criteria. Immediately before extubation, the SBT trial was repeated using a specialized ventilator capable of non-invasively measuring respiratory system compliance, inspiratory effort, and respiratory drive, assessed as occlusion pressure during the first 100 milliseconds, or P0.1. In this trial, 19% of patients who met SBT criteria and were treated with high-flow oxygen after extubation required re-intubation within 72 hours. While respiratory rates and tidal volumes were similar across patients, important physiological differences were found in lung mechanics and breathing effort. In patients who remained successfully extubated, lung compliance and inspiratory effort remained stable throughout the trial. In contrast, those who failed extubation showed declining lung compliance and increasing inspiratory effort, indicating escalating respiratory strain to maintain ventilation. Respiratory drive also markedly increased in this group. Further analysis revealed that relatively small changes during SBTs were highly predictive of extubation failure. A small drop in lung compliance or a rise in inspiratory effort accurately identified patients at risk, outperforming traditional measures. These findings suggest that some patients can meet SBT criteria by compensating with increased effort rather than true respiratory readiness, which in turn leads to false positives and failed extubations. Monitoring for a progressive reduction in respiratory system compliance and an increase in respiratory effort over the course of an SBT may improve prediction of extubation outcomes. For details, please read the article by Dr. Francesco Murgolo and colleagues. Thank you for watching Blue Briefing.